Hi, I'm Dr. Regina Joseph, cosmetic gynecologist in HSR Layout, practicing at Splendore Aesthetic Clinic, Bangalore. As we know, the women, due to the aging process, would go through a lot of changes within our body. Maybe because of the hormonal changes, that's meant as the physiological changes during the childbirth of the baby, during her reproductive age group, and postmenopausal age group. The most common thing what we see in the perimenopausal and postmenopausal age group, because of the deficiency or lack of estrogen hormones, the woman would have lot of vaginal atrophy, vulvovaginal atrophy or dryness of the vagina, which thus leads into deprivation of the sexual pleasure. So in this case of women who have this decreased sexual pleasure, we can always recommend vaginal rejuvenation by carbon dioxide laser, which I have already mentioned as a OPD care procedure, which has got no downtime and done at an interval of 4 weeks apart, and 3 sessions are given to the patient. And also to increase the sexual desire, because of lack of estrogen in women, we can give organic shots, which are nothing but PRP, the blood taken from the women, the plasma rich proteins. These platelets in turn, when are injected into the vaginal wall, it also causes releases of more growth hormone, which in turn causes vascularization and strengthening of the vaginal wall, and thus increase in the sexual pressure. It also increases lot of vaginal secretions or increase, which makes it more lubricative, and overall the woman would start feeling better. Thank you.